Welcome to Heart Failure Unfiltered. My name is Nick Hartshorne-Evans and I am the founder and CEO of the Pumping Marvellous Foundation, the UK's heart failure charity. Today, in this new 3-part series from the Pumping Marvellous Foundation, we're opening up the real conversations about cardiac devices, not just what they are, but what they mean for your life. This podcast is episode 3 of 3 of a series talking about cardiac devices and their role in the management of heart failure. Episode 3, It's the Heart That Talks. Remote monitoring, TriageHF and the future of heart failure care.
What do people living with heart failure need most?
Clear information, compassion and confidence. When patients understand their condition and feel supported, they're far better able to manage their health and live well.
When someone hears the words, "you have heart failure," they often feel frightened and alone. Your support helps us to make sure the next patient gets the information and reassurance they need. £10 helps us provide information and support to someone living with heart failure who may otherwise feel alone. Donate £10 at pumpingmarvellous.org.
Well, today, we are at the Liverpool podcast studios because we live here. And we've got so many podcasts. Go and have a look at our YouTube channel and Spotify channels. You'll see a lot of the podcasts are being dialed in once a week or twice a month or whatever. So anyway, let's discuss about these little things, which are, well, this one is a cardiac resynchronization and ICD therapy device that sits here in a pocket. So today we have over there.
I'm Gavin Redhead. I'm a patient educator with Pumping Marvellous, and until 2 years ago, I lived with an ICD for 15 years.
Hi, I'm Fozia Ahmed. I'm a heart failure and device cardiologist based in Manchester.
Hello, I'm Corinne Hudson and I'm a heart failure patient educator with Pumping Marvellous and deputy chair trustee too. And I have had a device for 4 years.
So let me start with this. Are we moving into a world, this is Fozia's question thing, are we moving into a world where the heart can tell us if it's in trouble before the patient even knows about it?
Yeah, I think you're talking about remote monitoring. So the idea is that patients who've got pacemakers, defibrillators, they can be paired with remote monitoring systems, which is either a monitor that sits at home in the bedroom or an app on your phone, which communicates with your device in a one-way direction. So information flows from the device to the app or to the remote monitoring system. And it monitors continuously when they're in contact. And if a problem is detected, whether that's a therapy from your device, whether it's an abnormal heart rhythm, either from the top or from the bottom chamber, or too many extra beats, or if it detects fluid in the chest or a significant shift in activity, it can send alerts to your healthcare team who might be, 50, 60 miles away. It's using...
or further.
Or further, yeah. So there's no geographic restrictions with remote monitoring now. So yeah, you make a great point. We've got patients who will have the app on their phone or who will take their home monitor on holiday with them in Thailand. And if anything's detected, it'll send it through.
So how does that, so it collects all that data. It's collecting data so how does that data translate into something that's clinically useful for you?
That's where algorithms come in. So if you think about it, we use algorithms every day. We use an algorithm to get here. So Google Maps.
Have you got an easier way of describing what an algorithm is?
Yeah, I'm going to go through that now.
All right, okay.
Think about traffic lights or satellite navigation. It's using an algorithm in the background, so complex mathematics to pinpoint where you are and tell you that you'll arrive on time to Liverpool Podcast Studios for 1 p.m. And it finds you the best way to get there. So devices routinely monitor large amounts of health data. This data is transmitted up into the cloud where it's processed by a medical algorithm. So things that may...
Who develops a medical algorithm?
That'll be the manufacturers typically. Okay. So each manufacturer will develop their own algorithms to process.
Do you have input into that?
Not really not from an algorithm development perspective.
So is this an engineering thing again?
Yeah, it's engineering. Right. So clever people, lots of maths. The algorithm will then weigh up the data and figure out what configuration signals a deterioration, which is what's stable and what does good look like. And if a deterioration in health data is detected, whether that's noise on someone's lead, whether that's extra beats that shouldn't be there, heart rhythm problems, too much fluid on the body, so worsening heart failure. An alert is then sent to the heart failure team or to the cardiac device team, who can look at the data, phone the patient, correlate the patient's symptoms with the data in front of them, and assess whether or not this signals a deterioration or if there's anything that they need to do about it. So it's monitoring health data remotely.
Does it do it continuously or just at point in time?
So it monitors
Because I'm
the
a bit
data.
concerned about the battery life.
Yeah, so it's been shown to have negligible impact on, no clinically significant impact on battery life. And that's because of the way that the data is flowing. So it's not done, if we think about one particular manufacturer's algorithm, the mathematics isn't done in the device, the mathematics is done in the cloud. So data is just raw data is just flowing out of the device. The complex stuff that takes up energy is occurring in the cloud. And for the vast majority of patients, they never have an alert. It's only if a significant shift in health data is detected that an alert will be sent. So what do these devices do? They monitor heart rate, heart rhythm, fluid levels, abnormal heart rhythm, patient activity level. So they've got an accelerometer inside them, which can detect changes in physical activity.
Wow.
So you can see whether or not someone's physical activity is high, medium, low, if there's been a significant decline or
So
shift.
these have huge benefit.
Huge benefits, yeah. And we only use a small amount of the data that is collected by these devices. And the point is we could use so much more of the data to inform how we not just... So yeah, the devices have shifted purpose. They're not just devices that detect and treat abnormal heart rhythms or resynchronize the heart. They can be used to monitor and manage broader health conditions. So
this plays into the prevention, into prevention, secondary
100%.
and tertiary prevention.
But I guess from my perspective, it's about detecting deterioration early and preventing or reducing avoidable hospital admissions, because each hospital admission leads to a stepwise decline.
Because that's what we measure.
Yeah.
Okay, so we're going to talk about TriageHF because I wasn't involved in it, but I was involved in a committee that assessed it. I know we have somebody who was on the trial as a patient, and we've also got one of the main architects, which is yourself. So can you explain what TriageHF is in simple terms?
Yeah, so TriageHF is the medical algorithm, which was designed by...
And there are other
algorithms available.
What HeartLogic?
HeartLogic is produced by Boston Scientific.
Yeah, so we talk about the two that
is Medtronic.
NICE have.
Yeah, so the rationale for discussing these two is that they've been assessed by NICE, as were other algorithms, but these were the two that made it through the review process and led to a change in clinical practice guidelines recommending that in patients who have a specialized device, a complex device, a specialized pacemaker or a defibrillator that can monitor what we call cardiac diagnostics or health data, that this data could be used to help monitor and manage heart failure stability or deterioration.
Gav, what was your experience?
So my third device, I had the first one 2009, second one 2016, and my final one, which Fozia put in, was in 2023. And when that device was put in, Fozia asked me if I wanted to be part of the TriageHF clinical trial, explain what it was and the fact that it would be a benefit and how it would make no difference to how the device functioned, etc. It was just a benefit, additional things. So I agreed to it. And I'm really glad that I did agree to it, because the device picked up that I'd gone into AF and I had ended up in advanced heart failure. Because I didn't know anything about it. I didn't know I'd gone into AF. It happened during the night. And I had a phone call from Fozia out of the blue saying, are you feeling okay? And I went, I think so, but I think something's happened because my watch is saying I've gone into AF, and you have. So Fozia arranged very quickly for me to get into Manchester to see the team. I saw the team, had one or two more tests and then I got referred to the advanced heart failure team. And very quickly I was put on the transplant list, and 5 weeks after that I had a heart transplant.
So so let's just make this really, really clear to anybody listening or watching this, okay? That doesn't necessarily Having TriageHF doesn't mean that you're going to go your direction, but would you have had to just relied on your Apple Watch?
No, I wouldn't have, because I didn't. I was there going, oh, it's probably just one of those blips. It happens all the time.
So would
Things
you
go
actually?
wrong.
Right. So TriageHF basically.
Yeah, it saved my life. It led to the decision that I had to be moved to the advanced heart failure.
That's huge. Wow.
Yeah. So one of the things that you can detect beyond people going into abnormal heart rhythms is whether or not there are other signals of deterioration. Is someone's physical activity declining? If it's declining, is it because they're slowing down? Are they developing increased fluid on their lungs more often, more frequently? And then when those signals keep going up and they're not staying down, or they're not returning back to baseline.
So they're not blips, they're continuous.
They're not blips, but they're stronger signals of directionality or change in clinical condition. And when you correlate that with asking someone, actually, do you feel the same, or do you feel that there's been a deterioration? And it can be a signal for the next step. So you check someone's heart hormone level. And actually sometimes it's the alerts that are the primary flag, or that are the flag to say, check this patient out a bit more thoroughly.
Because I was just on routine monitoring, regular 12 months.
What's routine monitoring?
6 monthly, 12 monthly, turning up see the physiologist, maybe have an ECG.
Did you have a little box next to you?
I didn't have that. On the last one, I got the app on the phone, which was much better for me, because instead of having this almost at night, sometimes you see it lit up almost like a Wurlitzer organ, all these lights going off and everything. And you're thinking, what the heck's going on? But sometimes it's transmitting the information, is it? Having it on your phone is much more simplified, and it's easier for transporting as well. So if you physically go on holiday, then at least you can take it with you.
You're still talking?
Yeah.
Wow. So, Corinne, you've been listening to Fozia and Gav. Do you think, in your opinion, that there's data overload for patients? Do you think that concerns them with?
I personally don't. I'd love to have as much monitoring as possible. I think with heart failure, I mean, as just proved by what Gav's just said, and as much that, he was going towards advanced heart failure stage, and he wasn't really aware of it. Some of the signs and symptoms can be quite subtle, and you go round and round in your head of sort of, is it that? Is it not that? And to take that noise away and to have something that's in the background that does all that for you and gives you all that data. And then if you want to be able to look at that yourself, then great. But if you don't, you can just switch off and leave to everybody else, and you can make that decision then, can't you? But I would much prefer something monitoring absolutely everything that's going on with me, so I don't have to think about it and just think it's fine. Don't even think about it. It's all been looked after. Other people can do it.
If you've been diagnosed with heart failure, a heart attack, or another heart condition, you might feel unsure about what comes next. That's where cardiac rehabilitation can help. At the Pumping Marvellous Foundation, we offer free access to cardiac rehab support, designed to help you rebuild confidence, understand your condition, and feel stronger again.
I'm in agreement with what you're saying, because there has been conversations around people saying, well, there's too much data, it's too much anxiety, extra anxiety on top of. But with the majority of the cardiac devices anyway, in fact, all of them now, but previously, in previous years, they were sending information back anyway to the hospital. And this was just another layer, but this layer gives, this is about self-management. This is about identifying it before the patient before you actually feel it. And, I think that is really, really, it plays into this, how do we get people to live better with heart failure?
Yeah.
And one of the things that helps people live better with heart failure is creating foundations that they can stand on and they can then build their life back on.
Yeah.
And this is something definitely, this could be a revolution in house building. Yeah. It's better mortar. Yeah.
Yeah.
But it's only for people who have a cardiac device. But it seems from a patient advocacy position, and what I see is that those people have a device for a reason. So therefore, there may be people who need more assistance, and therefore, this is a really good tool to help them live better with their heart failure.
Yeah.
And so when it happened, you've got your screen, and I presume it's a red flag type sort of system. How do you clinically clinically react to that? What do you do?
So the idea is it's not designed to, it doesn't radically change. There isn't a certain protocol that we follow for patients who've had a flag compared to people who would see in clinic. The point is quite simple, is that based in the NHS, we see people with heart failure every 6 to 12 months for 20 minutes. But it's in between those long periods when patients aren't being monitored or managed from a heart failure perspective that they're most likely to decline, deteriorate, or have a hospital admission. So this is about, if I get a flag and say, I don't know, I saw the patient 2 months ago, they appeared stable. Heart failure can sometimes deteriorate between appointments. When that flag is received, we phone the patient, run through their symptoms, see whether or not they've noticed any worsening, any extra fluid on board. If so, we address that. We make sure that their heart failure medications are optimized. We make sure that the last recorded blood pressure that we saw was in good range. So it's all about doing things that would ordinarily do in a clinical appointment, but over the telephone, and perhaps that might be used to schedule a sooner review in the clinic if, it's not just a case of, I've been on holiday, I didn't take my medications. Or I had dialysis and I missed my dialysis session and that's why my fluid levels went up. So if it's not something that's immediately obvious as to correctable over the telephone, if it's perhaps doesn't respond to small amounts of increases in medications or diuretics, then we bring the patient in for a sooner appointment, because not everyone we assume that everyone's going to be fine at those 12 monthly intervals, and they're not.
It sounds like a no-brainer.
Yeah. And
but are we fully utilising it?
Increasingly, it's been adopted. I think the NHS plan is helping us move towards this. So transitioning care from being analogue, so not very digital, to digital. So this allows us to do that remote monitoring, preventing hospital admissions, improving health, preventing sickness. So it all very much aligns with the direction of travel of the NHS now, that actually we need to look at technology's moved on, and so should healthcare, and so should heart failure and device care.
But I think this type of intervention plays to what the NHS measures its performance around heart failure, which we know comes down. I mean, it is multiple, but the three. Yeah, cost around hospital admissions, reducing that, people's quality of life, and improving or reducing mortality. Where do you see this going in the next 5 to 10 years then? And is this just part of one big, don't lambast me for this, but AI sort of machine learning type sort of, can we predict? Do you think we can be able to predict it?
It is exactly that. It's ambient AI technology, as they
Ambient, I
call
love
it.
that.
So it's sitting
that's
in the
great.
background, the patient's not having to do anything, and it's continuously monitoring data without any action required on behalf of the patient. Why is that really useful? For me, I've got we see two different types of people in clinic. Those who will phone us when they think they've got a problem, and those who never phone us, either because they don't want to worry us or they think there's nothing wrong. And the first time we see them is when they come through on a stretcher into the emergency department. And what the device monitoring does is it allows us to identify, democratizes healthcare, your kind of favorite thing to talk about. It equalizes healthcare so that then the devices send a signal to us without any action required on behalf of the patient, which allows the patient to get help at a time when they need it, when they might be in need, rather than at these arbitrary scheduled 6-12-month time points when actually I might be seeing you and we're talking about your holiday because you're well, there's no issues. We need to see people when they are in need.
So it cuts through some the emotion of being a person living with heart failure.
Yeah,
and
but
gives you the
it
knowledge.
cuts through some red tape treacle for patients as well, because trying to access care when you're sick is sometimes difficult. This allows us to contact the patient when a signal of deterioration is first detected.
So the apps that people have.
Yeah, it's just one more app on your phone.
But has it got like a user AI interface on it that tells you what's going on, or do you think that's too much?
Yeah, I think there will be developments in the future where it allows patients to perhaps know when there's been a change in data and perhaps ask them questions remotely. We're not there yet. Or be able to submit blood pressure readings to the hospital so that when we get these flags, we're able to titrate medications or change medications with a bit more fidelity and confidence because we've got other parameters monitored.
But there is the option, isn't there? As a patient, you can trigger a remote.
Yes.
So we have the ability with the thing. Yeah, we can say send them a report because I don't feel great today. So that option, we can physically force that to happen without it being monitoring. It's just an extra one, and then that goes off to.
I mean, surely surely people, and we're using the word democratizing. We are halfway through. We are wherever in an age of people wanting to see data, and don't you think that we've designed something here that may be around the clinician, but disregarded
we've had
patient?
So many discussions about what the next step will be.
Because we can help with that.
Yeah, perfect. I think nothing in medicine happens quickly. You have to gather the evidence. There needs to be robust analysis.
Years later.
And years later, once we've got the evidence, then it gets launched. And I think there was a need to demonstrate that this was going to be clinically effective, cost-effective, and evidence-based before we started to develop, actually to give hope to people that actually this is something that will stick, will fly, and will be part of care in the future. But now that we're there, I think you're right. We need to develop the user interface, the patient interface.
Because I remember an interface that was developed just purely for clinicians, and the user interface for the patient was...
Yeah, we're talking about a different app, right?
Yeah, nothing to do with... Yeah. This was a different technology, different app, whatever. And it was poor. And I remember I was very embarrassed when my patient educators saw this. I thought, I haven't really had any involvement in this, but that patient UI is really important. So I've got one last question here, because we've nearly spent 25 minutes talking about this, and I think it's really, really important because it certainly plays into the charity's focus around self-management, and it's an adjunct, an addition to helping people self-manage their condition. I remember many, many years ago, my heart failure nurse said to me, do you know what, if you can get somebody who can self-manage the condition really well and understand when they're putting weight on and all that, so why do you need telemonitoring? Well, this takes it a step further, and I'd say you do need this if you've got a cardiac device. So here we go. This is a big one for me, and a big one for like the NHS and health system is, so we have Fozia, who is unquestionably an expert, and we'll be thinking about the software, HeartLogic, TriageHF, and the benefits and value. But we know it's not wholly adopted. It should be. I think it should be, and why not? Doesn't that then lead to health to widening health inequalities, Corinne?
I guess, I mean,
you're managed by a DGH in, I don't know, I'm just looking at a set of curtains, Curtain City, yeah? and you're managed by a big hospital, but it hasn't got a device centre, or it's not a specialist.
Yeah, so therefore it's going to be limited to where you are, maybe. And also the person on the receiving end of that, if they are the person that's that works with their phone, have they got the phone technology? Have they got the knowledge of how to use that? Have they got...
See, I was asking the question from a different angle there. Yeah, it's good to see, grounds me as usual. Go on.
So it could limit who can access and who can sort of be part of that. But I'd like to think that, going forward, if that's how it needs to be done, and if it needs to be an app on the phone, then we support the patient by having a device that's portable that maybe isn't a smartphone. It's something else that they can carry around that's portable. So it makes that distinction that way. I don't know.
Okay. So, Gav, thoughts?
I mean, to me, it's a no-brainer that it should be implemented for every device. If you've got something that's already in your body and it can do additional functions, you would turn it on, wouldn't you? And it's like the difference between an old brick-style phone and a smartphone. Yeah. You buy it for its additional features, its functionality. And if that can be part of your health and self-management. I mean, I was part of a clinical trial before and TriageHF, which was remote monitoring, where I had to weigh myself every day to put my blood pressure in every day and all that. And that was, part of that precursor to heart failure at home. If we're moving to that model where you need to be self-managing more and then signaling when there's an issue, then definitely it should be part of building in that patient experience and looking at how that can inform a patient to self-manage. I think that's critical.
I agree with both of what you've said. Fozia, last word.
Yeah, we're in an era of data-driven approach to everything, aren't we? And there's no reason why we can't have a data-driven approach to improving health and improving well-being of patients and helping people live longer with better lives. Last word, I guess, is that there is always patient choice. Very few patients choose not to have this functionality turned on, but we routinely monitor battery status and lead function using remote monitoring. This is just one more element of that, looking at heart failure data.
So I asked you what you get. What's the clinical process behind that activation, or this algorithm saying you need to look at this patient? We should be using the same data to widen understanding and what's the word I'm looking for? Adoption of the value of tech and self-management, because you can live well with heart failure. We've been talking about something that can help you live well with heart failure, and that's important to patients. That's really important to patients. So on that note, we're done. Thank you very much for joining me.
Thank you.
Thanks.